Nursing diagnosis. This is the second phase of the nursing process. Diagnosis is the clinical act of identifying the problems. Definition. North American Nursing Diagnosis Association, NANDA, defines nursing diagnosis as a clinical judgment about individual, family or community responses to actual and potential health/life processes. Nursing diagnosis provides the basis for selection of nursing interventions to achieve outcomes for which the nurse is accountable. Gordon, 1976, defines nursing diagnosis as an actual or potential health problems which nurses by virtue of their education and experiences are capable and licensed to treat. Carpenito, 1997, defined nursing diagnosis as a statement that describes the human response, actual/potential, of an individual or group which the nurse can legally identify and for which the nurse can order the definitive interventions to maintain the health state or to reduce, eliminate, or prevent alteration. Purpose. Helps identify nursing priorities and help direct nursing interventions based on identified priorities. Helps the formulation of expected outcomes for quality assurance requirements of third-party payers. Nursing diagnoses help identify how a client or group responds to actual or potential health and life processes and knowing their available resources of strengths that can be drawn upon to prevent or resolve problems. Provides a common language and forms a basis for communication and understanding between nursing professionals and the healthcare team. Provides a basis of evaluation to determine if nursing care was beneficial to the client and cost-effective. For nursing students, nursing diagnoses are an effective teaching tool to help sharpen their problem-solving and critical thinking skills.
Types of nursing diagnosis. The four types of NANDA nursing diagnosis are actual, problem-focused, potential, risk, health promotion, and syndrome. Here are the four categories of nursing diagnosis provided by the NANDA I system. Actual problem-focused nursing diagnosis. A problem-focused diagnosis, also known as actual diagnosis, is a client problem that is present at the time of the nursing assessment. These diagnoses are based on the presence of associated signs and symptoms. They are written in three parts: 1. Problem, nursing diagnosis, 2. Etiology, related factors, and 3. Sign and symptoms, defining characteristics. Examples of actual nursing diagnosis are: hyperthermia related to infectious process evidenced by verbal communication. Acute pain related to decreased myocardial flow as evidenced by grimacing, expression of pain, guarding behavior. Potential risk nursing diagnosis. These are clinical judgment that a problem does not exist, but the presence of risk factors indicates that a problem is likely to develop unless nurses intervene. There are no etiological factors, related factors, for risk diagnoses. Components of a risk nursing diagnosis include: 1. Risk diagnostic label, and 2. Risk factors. Examples of risk nursing diagnosis are: risk for falls as evidenced by muscle weakness, risk for injury as evidenced by altered mobility, risk for infection as evidenced by immunosuppression. Health promotion wellness diagnosis. Health promotion diagnosis. Wellness diagnosis is a clinical judgment about motivation and desire to increase well-being. Components of a health promotion diagnosis generally include only the diagnostic label or a one-part statement. Examples of health promotion diagnosis: readiness for enhanced spiritual well-being, readiness for enhanced family coping, readiness for enhanced parenting. Syndrome diagnosis. A syndrome diagnosis is a clinical judgment concerning with a cluster of problems that are predicted to present because of a certain situation or event. They are written as a one-part statement requiring only the diagnostic label. Examples of a syndrome nursing diagnosis are: chronic pain syndrome, rape trauma syndrome, post-trauma syndrome, frail elderly syndrome. Possible nursing diagnosis. Possible nursing diagnoses are statements describing a suspected problem for which additional data are needed to confirm or rule out the suspected problem. Examples include: possible chronic low self-esteem, possible social, Isolation. Components of a nursing diagnosis. A nursing diagnosis has typically three components. 1. The problem and its definition. 2. The etiology. And 3. The defining characteristics or risk factors for risk diagnosis. Problem and definition. A diagnostic label usually has two parts: qualifier and focus of the diagnosis. Qualifiers, also called modifiers, are words that give additional meaning. Qualifier. Focus of the diagnosis. Deficient excess. Fluid volume. Imbalanced. Nutrition, less than body requirements. Impaired. Gas exchange. Ineffective. Tissue perfusion. Risk for injury. Etiology. The etiology are the conditions involved in the development of the problem. Etiology is linked with the problem statement with the phrase, related to. Defining characteristics. Defining characteristics are the clusters of signs and symptoms that indicate the presence of problem. Defining characteristics are written following the phrase, as evidenced by, or, as manifested by, in the diagnostic statement. Diagnostic process. There are three phases during the diagnostic process. 1. Data analysis. 2. Identification of the client's health problems, health risks and strengths. And 3. Formulation of diagnostic statements. Analyzing data. Analysis of data involves comparing patient data against standards, clustering the cues, and identifying gaps and inconsistencies. Identifying health problems, risks, and strengths. These are the facts that support tentative actual, risk, and possible problems. Formulating diagnostic statements. Formulation of diagnostic statement is the last step of the diagnostic process wherein the nurse creates diagnostic statements.
Sources of error in nursing diagnosis. Problem in collecting data such as lack of knowledge, lack of skill, inaccurate data, missing data, disorganized data. Problem in interpretation of data such as inaccurate interpretation of cues, failure to consider conflicting cues, use of invalid data, giving less consideration to cultural influence and development stage. Problem in labeling nursing diagnosis such as wrong selection of diagnostic label, failure to validate nursing diagnosis with patient, failure to seek guidance, corrective measures to avoid error in nursing diagnosis. Nurse must have up-to-date knowledge and clinical experience. Nurse should have knowledge of not only nursing subjects but also of other subjects, chemistry, biochemistry, pharmacology, etc. It will help her to understand client's data. Nurse should have knowledge of normal values such as BP, temperature, blood count, ESR. Along with this, she should know what is normal for a particular person, keeping in mind age, education, occupation, lifestyle, culture, and religion, etc. Instead of proceeding with missed data, nurse should interact with client again and should have complete information. Nurse should verify the conflicting/ambiguous data/cues. She can consult her expert colleagues, records, etc. In case of doubt in labeling nursing diagnosis, nurse should be resourceful, i.e. consult/use a nursing diagnosis handbook. She can keep list of NANDA diagnosis in her pocket diary. As nurse is dealing with human life, she should never hesitate to take expert opinion. Nurse should improve critical thinking skills. Nurse should state/label diagnosis briefly, specifically. Nurse should identify one problem in each nursing diagnosis. Nursing diagnosis must be based on patient's database. Nurse should keep in mind that problem and cause is not same thing. For example, alteration in comfort related to fracture of RT hip. Wrong. Alteration in comfort associated with pain in right hip. Right. Acute pain related to right hip fracture. Always state nursing diagnosis in a way that directs nursing intervention/strategies. Example, anxiety related to diagnostic test, sleep pattern disturbance related to hospitalization. Importance of nursing diagnosis. Nursing diagnosis taxonomy provides a common language for communication. It helps to understand in better way. E.g., if nursing diagnosis for client is activity intolerance RT prolonged bed rest wherever the nurse is residing, everyone will understand it because all nurses are following one taxonomy, i.e. NANDA. It provides a means of communicating to other nurses, healthcare team. As nursing diagnosis is framed by nurse and she is licensed to treat it independently. It facilitates development of nurses' autonomy. It helps the nurses to be accountable for their profession. Making accurate nursing diagnosis helps to ensure that client receives quality nursing care. Thus, it serves as a focus for quality improvement. Nursing diagnosis gives direction for planning nursing intervention. Nursing diagnosis taxonomy helps to bridge gap between knowledge and practice. Ultimately enhances the scope of nursing practice, which is very important for developing nurses' professional role in healthcare.
Nursing diagnosis for care plans. This section is the list or database of the common NANDA nursing diagnosis examples that you can use to develop your nursing care plans. Activity intolerance, acute pain, anxiety, chronic pain, constipation, decreased cardiac output, deficient fluid volume, deficient knowledge, diarrhea, excess fluid volume, fatigue, fear, grieving, hopelessness, hyperthermia, hypothermia, imbalanced nutrition, less than body requirements, impaired gas exchange, impaired tissue, skin, integrity, impaired urinary elimination, ineffective airway clearance, ineffective breathing pattern, ineffective tissue perfusion, risk for falls, risk for impaired skin integrity, risk for infection, risk for injury, risk for unstable blood glucose level.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.